January after the Capitol Hill riots. Good evening. Thanks very much for joining us on India Business Hour. I'm Shireen Bhan. India records 3.82 lakh new COVID infections in the last 24 hours, reporting over 3 lakh cases for the 14-day running. This is also the highest rise in infections in the last 3 days. Daily addition to the death toll stays above 3,000 for the 8th day, hitting a record high of 3,780. As cases and deaths continue to rise, the government has warned that a third wave is inevitable, but it cannot be timed, nor is there any assessment of the scale. Take a look.
A phase 3 is inevitable, given the high levels of circulating virus, but it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape it. And therefore, we should be prepared scientifically to take care of that.
That is the principal scientific advisor saying we need to prepare for the third wave. Now, looking at the state-wise picture, Maharashtra has witnessed a steady drop in new infections, but it has reported the highest single-day case addition at 52,000, but it's a significant decline from the peak. In Karnataka, new infections have risen to 44,600, with the capital, Bengaluru, accounting for almost half the cases. This has in fact been red flagged by the Health Ministry. In Kerala, the figure has soared to over 37,000. Looking at the 7-day positivity rate across states, Goa continues to be the worst hit with a 43.4% positivity rate. In Bengal and Delhi, it's over 30%. In terms of the 7-day average growth rate, Uttarakhand is witnessing the highest growth in cases at 3.3%. Goa, Bihar and Rajasthan follow with the average growth rates of around 3%. Goa is also reporting the highest rate of testing among states with 4,200 tests per million per day. Delhi and Kerala are also testing over 4,000 people per million per day. On the other hand, testing in Bengal is below 600 per million, while in Bihar, Madhya Pradesh, UP, Orissa and Jharkhand, it's below 1,000 per million. Meanwhile, Love Agarwal, one of the key officials at the Health Ministry, says that Maharashtra, UP, Delhi, Chhattisgarh and Gujarat are showing early signs of a reduction in cases. Take a look.
हमने पिछली बार डिस्कस किया था कि कुछ स्टेट्स में हमें अर्ली साइंस ऑफ प्लेटोइंग और केसेस का डिक्रीज भी दिखाई दे रहा है। उसके तहत हम देखते हैं तो पाते हैं कि महाराष्ट्र में केसेस में रिडक्शन नोट किया गया है। इसी तरह उत्तर प्रदेश में भी, दिल्ली में भी कुछ केसेस में रिडक्शन नोट किया जा रहा है। छत्तीसगढ़ में भी इसी तरह केसेस में रिडक्शन दिखता है। गुजरात, मध्य प्रदेश, तेलंगाना, झारखंड, दमन एंड दीव, लद्दाख, लक्षद्वीप और अंडमान निकोबार, इन स्टेट और केंद्र शासित प्रदेशों में हम देखते हैं कि एक अर्ली साइंस ऑफ रिडक्शन नोट होता है।
And you can catch my interaction with top doctors from Delhi on the situation in the capital and members of the Maharashtra and Karnataka COVID task forces on the strategy for their respective states. That's coming up tonight at 9:30 p.m. The Supreme Court has set aside the Delhi High Court's contempt notice against the centre on the grounds that imprisoning officials at this point in time will not solve Delhi's oxygen shortage. However, the court has raised concerns over the centre's oxygen allocation formula. It has observed that the oxygen per bed methodology is not scientific and has directed that the real-time demand of states must be met. The special bench has also said that the common man's oxygen requirement cannot be static and it will fluctuate depending on the number of patients as well as the demand from hospitals. The apex court has directed the centre to file a concrete plan to meet Delhi's need for 700 metric tons of oxygen per day by Thursday morning. It's also instructed the centre to take Delhi's oxygen allocation to 700 metric tons per day and create a buffer stock. In addition, the court has advised that officials from Delhi and centre study the Mumbai model and consult with the BMC Commissioner Iqbal Singh Chahal on ways to create the oxygen storage tanks for Delhi, replicate the Mumbai formula in Delhi. That is the court's suggestion. As other states grapple with oxygen shortage, the Karnataka High Court has directed the centre to increase the oxygen allocation to the state to 1,200 metric tons for the next 4 days. It's also asked the state government to submit a projected estimate of oxygen required for the next week. Earlier this week, 24 COVID patients died in a hospital in a district allegedly due to the oxygen shortage. The state has appointed a retired judge to inquire into the deaths. The Allahabad High Court has observed that deaths of COVID patients due to non-supply of oxygen is no less than genocide. The court says that authorities responsible for procurement and supply of the gas are committing criminal acts. The court's observations come on the back of deaths of patients in Meerut and Lucknow, reportedly due to oxygen shortage. Now, India's daily inoculations continue to remain very low. Yesterday's tally stood at 14.8 lakh doses. Of this, 2.63 lakh doses went to people in the 18 to 44 age bracket. Now, since the 1st of May, over 6.7 lakh people in the 18 to 44 category have received their first dose. In all, India has managed to administer 16 crore doses since the 16th of January. That is when the vaccination drive kicked off. Now, despite a shortage of vaccines, Maharashtra has registered the highest number of vaccinations so far. It accounts for 10.2% of overall inoculations. Rajasthan is at number 2 with 8.4%. Gujarat and UP each account a little over 8%. West Bengal accounts for a little over 7%. Staying with vaccinations, in a move that could pave the way for the private sector to import vaccines like Pfizer and Moderna, the Central Drug Standards Control Organization, that is the CDSCO, has released new guidelines for the import of foreign COVID-19 vaccines. Now, for vaccines that are not yet approved or licensed in India, the importer will have to obtain 3 permissions or licenses from the CDSCO. Archana joins us now with the details. Archana, what do the guidelines say, and why is this a big step for the vaccination program?
Well, yes, if you remember, based on the liberalized vaccine strategy that is if in effect from 1st of May, all ready-to-use imported vaccines are allowed to be used in other than Government of India channels, which means by state governments or by any private entity, private hospitals or corporates who can directly import, negotiate with the companies and directly import those vaccines. Now, there are 2 heads. One are those vaccines which are approved in India already, and that would include the likes of AstraZeneca's vaccine Covishield, where some import batches could be brought in, or Sputnik V, which has just received approvals in India, and 1.5 lakh doses of the first shipment have already arrived here. In this category, only an import license is to be sought by the importer or an agent of the manufacturer, and they are ready to supply it to the private entities who would directly, or state governments who would directly make a negotiation for the purchase. The other category of vaccines are those that are not yet approved in India, who've not done clinical trials, and that would include the likes of Pfizer, Moderna, or Johnson & Johnson, among others. And for those vaccines, if they have been approved by the other international regulators like that of the US FDA, EMA, the Japan regulator, or even WHO, those vaccines, the importer needs to get 3 licenses. One is a new drug permission under the New Drugs and Clinical Trials Rule, an import registration, and an import license under the Drugs Rule 1945. And with the import license in place, they can import the vaccine and start procurement and supplies. Remember, Pfizer's CEO has already indicated they are in talks with the government for an expedited approval of the vaccine. And we also know that a lot of private hospitals, corporates, as well as state governments like that of Maharashtra are in talks with vaccine manufacturers like Pfizer for directly importing, individually negotiating and directly importing these vaccines to increase the supplies in India. Back to you.
Pfizer says it plans to file for full US FDA approval this month for its COVID-19 vaccine. The company will seek emergency use authorization for its vaccine for children between the ages of 2 to 11. Pfizer is also studying the safety and efficacy of its vaccine in children aged between 6 months and 11 years. As the second wave of COVID rages, the RBI has announced a 50,000 crore rupee special liquidity window to ease access to emergency health services for COVID. Banks can borrow cheap funds through this facility and lend to various healthcare stakeholders. The central bank has also unveiled measures to tackle the impact of the second wave of COVID-19, offering banks and NBFCs the flexibility to recast loans of small borrowers. It's announced a 35,000 crore rupee bond purchase plan under its GSAP plan as well.
Term liquidity facility of rupees 50,000 crore to ease access to emergency health services. To boost provision of immediate liquidity for ramping up COVID-related healthcare infrastructure and services in the country, an on-tap liquidity window of rupees 50,000 crores, rupees 50,000 crore with tenor of up to 3 years at the repo rate is being opened till March 31st, 2022. Given this positive response from the market, it has been decided that the second purchase of government securities for an aggregate amount of rupees 35,000 crore, I repeat, for an aggregate amount of rupees 35,000 crore under GSAP 1.0 will be conducted on 20th May. With system liquidity assured, The RBI is now focusing on increasingly channelizing its liquidity operations to support growth impulses, especially at the grassroots level. Small businesses and financial entities at the grassroots level are bearing the biggest brunt of the second wave of infections. Against this backdrop, and based on our continuing assessment of macroeconomic situation and financial market conditions, we propose to take further measures.
Well, that's the RBI governor on the measures announced today. Latha joins us now. Latha, what's your take on the announcements made by the governor? What kind of impact are they likely to have?
What was announced today should not be taken as stimulus. That was not the idea. Secondly, there was no across-the-board moratorium given. Some people were asking for it, but the governor, that was not part of the announcement. It is possible that the moratorium got into litigation with this interest on interest and stuff like that in the Supreme Court. So that could have been one reason why they avoided it. But the impact, the reason why they may not have gone for across-the-board stimulus or moratorium is the perception that this second lockdown is not nationwide. It has not hurt manufacturing. Factories are still allowed to function. So the Reserve Bank has chosen to only concentrate on what you may call the informal sector. I mean, who loses if Bombay is closed down or Delhi's shops are not allowed to open? It's largely the informal sector, the vendors. So there is a healing touch for vulnerable borrowers. That seems to be the intention of today's announcement. And the second is to force banks or to incentivize banks to lend to those who are in the forefront of the COVID war. Hospitals, diagnostics, importers of oxygen concentrators and things like that. Finally, there was the added announcement of the government securities acquisition plan, that is RBI buying government securities. Also, the tone of the governor while describing the economy was somewhat non-hawkish. He was, although he's alluded to the rise in commodity prices globally, he said that the good harvest will soothe inflation in India. So there was a dovish tone, or at least a non-hawkish tone. So you saw the yields fall. That was another key takeaway for the economy, that the governor intends to keep yields soft. He talked down the yields, as it were.
All right, Latha, many thanks for joining us. And as Latha was pointing out, the RBI's announcements gave financial and pharma stocks a boost. Markets closing the day at the day's high. The Sensex and Nifty gained about 1% each. The Nifty Pharma jumped 4% higher. Now, S&P Global Ratings says the second COVID wave may derail India's budding economic recovery. In a moderate case scenario, the agency assumes a 1.2 percentage point hit to India's GDP in FY22, pegging the annual growth figure at 9.8% versus a forecast of 11% earlier. That number is seen going up to a 2.8 percentage point cut in case of a severe COVID scenario. It expects credit profiles of Indian companies to remain resilient, but expects banks to face higher levels of systemic risk. A report by the Azim Premji University on 1 year of COVID-19 finds that economic recovery is incomplete and that by the end of 2020, about 15 million workers remained out of work and incomes remained depressed. The report also highlights that the pandemic has taken a far heavier toll on poorer households, with the number of individuals below the national minimum wage threshold increasing by 230 million during the pandemic. Women have also seen a disproportionately higher increase in unemployment, with 47% jobs permanently lost during this time.
We do believe that from what we know of 2020, we are in for some very troubled times in the economy, particularly for vulnerable households. I think we can anticipate, based on what we know, that the vulnerable are going to be affected again very strongly on a weak base, because as you said, they've already suffered. So there is urgent need to act now for two reasons. One, compensate for the losses suffered last year, and to anticipate what are almost certainly going to be more impacts on people not being able to earn, people not being able to go to work, and so forth.
Well, those are the highlights of the Premji report on the state of work. The G7 meeting in London is hit by a COVID scare after two members of the Indian delegation tested positive for the virus. External Affairs Minister S. Jaishankar and his team have gone into self-isolation and will conduct all future meetings virtually. But other face-to-face meetings have gone ahead as scheduled, since the Indian delegation had not yet attended the main summit venue. UP has extended the statewide curfew till the 10th of May as the COVID situation worsens. The restrictions were set to be lifted tomorrow. All shops and establishments will remain closed till Monday morning. All essential services will be allowed and vaccination will continue. The Haryana police has arrested 45 people and registered 21 FIRs in connection with the black marketing of oxygen cylinders and remdesivir injections across the state. 77 oxygen cylinders and 101 vials of remdesivir have been recovered in this operation. It's time for us to take a break, but when we return, the government allows private and public sector companies to use CSR funds to build healthcare infrastructure to cope with COVID-19. More on that when we return.
आग को फैलने से रोकना मुश्किल है, पर नामुमकिन नहीं। अब फायरवॉल टेक्नोलॉजी के साथ सेंचुरी प्लाई आग से बचाए।
At the heart of every great change is a great human. Come help us create value with businesses everywhere.
आ गया है इंडिया का सबसे बड़ा होम डिलीवरी सेल। बचत करिए घर बैठे।
300 रुपए कैशबैक, फ्री होम डिलीवरी और ढेरों ऑफर्स। बिग बाजार होम डिलीवरी सेल 1 से 9 मई। बिग बाजार।
Youngsters was one of the pivotal inspirations for us to turn towards entrepreneurship.
Entrepreneurs don't start companies just to make money. Once you have category defining companies and good business model, wonders happen.
Search for value, that's been the mantra for Young Tech for almost 2 decades.
India's most credible thought leadership platform and the world's longest running show on startups and entrepreneurship. Young Tech out at these times. A show that is unmatched.
We tell you stocks to watch out for and which sectors are impacted.
Thought-provoking.
Number crunching is very easy. The gap lies in understanding your own mind and how that at times can derail you from what you want to achieve.
And will give you maximum value for your money.
Artificial intelligence, CRISPR in healthcare. Play on these themes, invest in these companies when they're small currently and building towards the future.
A masterclass with India's biggest market experts. Smart money at these times.
Savings is just not possible on medicines.
It is possible. On NetMeds, you can get every medicine lesser than MRP. NetMeds app gives the best offers and savings up to 20% on MRP. Now for super savings, NetMeds, India's own pharmacy.
आग को फैलने से रोकना मुश्किल है, पर नामुमकिन नहीं। अब फायरवॉल टेक्नोलॉजी के साथ सेंचुरी प्लाई आग से बचाए।
The Ministry of Corporate Affairs has allowed firms to use CSR funds to build healthcare infrastructure for COVID care. The ministry has also said that companies, including government companies, may undertake the activities, projects or programs using CSR funds directly by themselves or in collaboration as a shared responsibility with other companies. Nisha is here with the details. Nisha, what are the activities that can now come under CSR spending? What has the ministry said?
As corporate India really dedicates a large part of their resources and infrastructure with compassion to help the country in combating the healthcare crisis that is faced in front of the citizens. By dedicating their important resources, the Ministry of Corporate Affairs has also put a helping hand. They've clarified the scope of the COVID-19 care activities under the CSR fund. In fact, the MCA has clarified that as per the company law, the mandatory amount of CSR fund that is required by the company to be spent as part and percentage of their profit can be channelized into the healthcare infrastructure facilities that are being provided to help the government combat the COVID-19 situation in the country. Case in point being the oxygen crisis, where a lot of steel companies, metal manufacturing companies have really put their might behind the people of the country to really combat the crisis. They have provided not just oxygen to the hospitals, but even ventilators and concentrators. All those would come under the gambit of the CSR funding. from the company, even any medical infrastructure as well as any storage facility for oxygen, which even includes the cylinders. So any sort of healthcare infrastructure and equipment which is required to combat COVID-19 situation can be utilized from the CSR funding of the company. What it does for the companies is that it does not put a pressure on putting additional resources for helping out the country in this time of crisis. They can channelize all of their CSR funding, which is anyways mandatory to be spent on social responsibility, and that can really help the country also in putting the health infrastructure in place where every resource is very, very important. And also remember, as part of this, the corporate social responsibility is an integral part of the ESG standards of the company, which they now need to comply with.
Nisha, many thanks. Citigroup has announced an additional 200 crore rupee pledge towards COVID recovery and relief efforts in India over the next 3 financial years. Of the total pledged amount, 75 crores is being allocated immediately towards the procurement of oxygen supplies, adding hospital beds, diagnostic testing kits and PPE kits. The funds will also be for food and hygiene supplies for low-income families. Citi is not alone. UBS has said it will donate $1.5 million in relief efforts to India. Its first tranche will target supplying oxygen immediately along with other medical supplies and medicine to those who need them the most. UBS will work with Bangalore-based NGO Swasthi to deliver health solutions across India, and later it plans to support COVAX for the equitable procurement and distribution of vaccines. Trinamool Congress Chief Mamata Banerjee begins her third innings as the Chief Minister of West Bengal, says the first priority for her government is to tackle the COVID surge in the state.
আমাদের ফার্স্ট প্রায়োরিটি কোভিডকে কন্ট্রোল করা।
Controlling the COVID situation is our first priority. We'll be holding a meeting to take stock of the situation today. We will let you know about the steps taken.
সেই মিটিং ডাকার পরে এগুলো কি করব না করব আপনাদের আমরা ঠিক টাইমে জানিয়ে দেব। আমি সবাইকে সব রাজনৈতিক দলের কাছে আবেদন করব।
I urge all political parties to maintain peace and harmony.
বজায় রাখুন, সংহতি বজায় রাখুন। বাংলা কিন্তু কোনো অশান্তি পছন্দ করে না।
Mamata Banerjee being sworn in, and fresh restrictions have now been announced by the West Bengal government. The DMK chief MK Stalin calls on Tamil Nadu governor to stake his claim to form the next government. DMK MLAs have unanimously elected Stalin as their legislative party leader. The Supreme Court has agreed to hear a petition to stay the construction work on the government Central Vista project, but the Apex Court has not fixed a date to hear the matter. The Supreme Court has quashed the law passed by Maharashtra that grants reservation to Marathas in jobs and educational institutions. It says there is no need to examine its 1992 verdict capping the quota at 50%. The UP government issues directives to set up help desks to protect cows in every district. The state government also issues instructions that all cow shelters must follow COVID-19 protocols. The use of masks and frequent thermal screening will be made mandatory. And in top global stories, the oversight board of social networking site Facebook upholds the ban imposed on former U.S. President Donald Trump following the U.S. Capitol riots, but says the ban cannot be indefinite. It must be reviewed in 6 months, adding that by applying a vague and standardless penalty and then referring the case to the board, Facebook is seeking to avoid its responsibilities. U.S. Treasury Secretary Janet Yellen says the U.S. Federal Reserve may have to increase interest rates to keep the American economy from overheating, adding that the additional spending by the U.S. government could cause some very modest increase in interest rates. Meme cryptocurrency Dogecoin continues to soar by 50% for the second day running. Endorsed by Elon Musk and Mark Cuban, the cryptocurrency has risen over 14,500% in 2021. And with that, it is time for us to wrap up this edition of India Business Hour. Thanks very much for watching. Stay tuned. The news will continue here on CNBC TV 18.